President, pursuant to Standing Order 62A, I give notice of an amended form of motion number 7, Premier's attitude to ambulance ramping, as follows. That this House, A, expresses grave concern at the record levels of ambulance ramping in our state, including the unprecedented 7,013 hours recorded in July 2025, which was subsequently exceeded with 7,074 hours recorded in August 2025. B, notes that 1, the Labor government came to office in March 2017 promising to improve the performance of the health system when monthly ambulance ramping had never exceeded 2,300 hours. 2, under successive Labor ministers Cook, Sanderson and Hammett, monthly ambulance ramping hours have escalated exponentially to record highs. And 3, persistent ramping delays have been linked to adverse patient outcomes, increased stress on paramedics, and an overall decline in emergency response capability. C, is not confident that the government is treating this issue with the level of priority it requires. D, rebukes the Premier for his dismissive attitude towards concerns raised throughout the community, which was particularly on display in his refusal to even read a short letter of concern from the Leader of the Opposition, Basil Zemplis MLA. And E, calls on the Premier to, without delay, 1, apologise to the people of Western Australia for ambulance ramping having worsened so dramatically during his tenure as either Minister for Health, Deputy Premier or Premier. 2, review the model he imposed following the 2025 state election that now sees the health portfolio split between a multitude of ministers. 3, axe the racetrack proposed for Burswood Park and reinvest the $217.5 million into our health system to address the hospital crisis. And 4, personally take responsibility to ensure that his new health minister makes this her top priority, prepares a plan, executes it, and reports on it monthly to Parliament until it is under control. Our health system is in crisis. The evidence is overwhelming that this government has failed to appropriately address the issues in our health system. This is a matter of grave concern. Western Australians are paying the price. How can we tell that a health system is in crisis? The constant war stories and the issues raised in the media should be a very obvious red flag, but there's more symptoms than that. We have long delays in emergency departments. Doctors, nurses, paramedics and other health workers are getting burnt out. We have crumbling health infrastructure, daily code yellow emergencies in hospitals due to overcrowding, cancelled elective surgeries and ambulance ramping. Ambulance ramping, sometimes called offload delay or off-road or transfer of care delay, happens when patients remain stuck in ambulances outside emergency departments because the hospital cannot accept them. It means our ambulances, which cost between $150,000 to $300,000 each, and which are designed to respond quickly to emergencies, are left languishing in idle queues outside hospital entrances while patients are waiting for a bed. This is of grave concern. Medical bodies, including the World Health Organization, have recognised that these sorts of delays pose a direct risk to the health of a population, stating that timeliness is an essential component of quality and that millions of deaths and long-term disabilities from injuries, infections, mental disorders and other mental health conditions could be prevented each year if emergency care reached them in time. In July 2025, Western Australia recorded 7,013 hours of ambulance ramping in a single month. Last month, in August, that record was broken again, with 7,074 hours of ambulance ramping. Let's just pause and take a step back in time to put that into perspective. When Labor came into office in 2017, monthly ramping hours had never exceeded 2,300. In just 8 years, that figure has more than tripled. The Honourable Roger Cook, who was Labor's shadow health spokesman in 2016, said at the time that the problem of ambulance ramping and patient delays at our hospitals is out of control. In fact, ramping numbers were a big part of the Premier's argument that the then Health Minister, the Honourable Kim Hames, should be sacked. And now ramping records have been broken in the worst possible ways. We're not just talking about numbers for the sake of it. We're talking about the reality, as emphasised by the World Health Organization, that integrated emergency care delivery can save lives and maximise impact across the health system. The staggering numbers of ramping hours are proof that our health system is sick. It lacks capacity, it is under-resourced, and it's not functioning as it should. And unfortunately, this problem is not restricted merely to our metropolitan area. In June this year, regional hospitals spent over 240 hours waiting to transfer patients between hospitals into care. In July, that was 139 hours, and in August, 247 hours. Bunbury Regional Hospital saw the worst of these recent figures. In June, they had more than 200 of those 240 hours of ramping. The Australian Medical Association and the National Rural Health Alliance have called on the government to address a chronic shortage of medical staff, a problem that they consider is growing. While the statistics are damning, they are more than statistics. They represent thousands of Western Australians waiting in fear and pain for urgent care. Ambulance ramping has real and devastating consequences. When ambulances are stuck at hospitals, they cannot respond to new emergencies. That means slower response times for strokes, heart attacks, serious accidents, and all medical emergencies. Research reported in the Medical Journal of Australia, in a study of over 200,000 people transported by ambulance to emergency departments, shows that if offload delays exceed 17 minutes, the risk of death within 30 days rises significantly. Persistent ramping delays are linked to adverse patient impacts and outcomes. Think about it when you're stuck in traffic. If you're stuck in traffic for 5 minutes, it's frustrating. If you're waiting at an intersection and just one car is going through at a time. If you're stuck in traffic for 10 minutes, inching slowly forwards, that is painful. But if you are stuck in traffic for 17 minutes waiting to get patients into hospital, into our emergency departments, think about the stress that that is causing for our paramedics, for those driving our ambulances who are trying to do their job. It affects our sick West Australians, and we are seeing increased stress on our paramedics who are forced to wait in ambulances rather than return to duty. Many are completely disheartened by the state of our health system. In March this year, when ramping hours were at around 5,000 per month, a frustrated paramedic voiced their concerns, stating that ramping is rampant. We spend between 2 and 4 hours a day shift on ramp. At night, crews are ramped a lot longer. 2 to 4 hours per shift. The paramedic continued, a system that is supposed to care for the sick has failed, and now we can only stand by and watch suffering. Overall, our emergency response capability is declining. Patients suffer, families wait helplessly, and communities are left vulnerable. WA Treasurer, the Honourable Rita Saffioti, recently said that WA is the envy of the nation after the state recorded a $3.1 billion budget surplus. But our ramping numbers certainly aren't the envy of the nation. And in light of what we are debating today, I must ask, what is the cost of this surplus? The government may boast. They may boast about a surplus, a racetrack, a rugby team, and a mega Metronet network. but everyday West Australians whose taxes have contributed to that surplus, would be very reasonable to conclude that the government has the wrong priorities. When considering whether we want more investment in transport in addition to the more than $13 billion spent by the Cook Labor government on Metronet, how about a bit more investment in our health system? We require confidence in our health system so that if our loved ones require urgent emergency care, we can be confident that our system can provide it. The reality is undeniable. There is not enough meaningful work being done to address the hospital crisis or the ramping crisis because the government has the wrong priorities. Pet projects like racetracks and rugby teams and a mega Metronet system are put at the top of the program while our hospitals crumble. The government is not treating this issue with a level of priority it deserves. And the people of this state are paying the price while the government pats itself on the back. An exhausted and frustrated paramedic captured it perfectly and tragically when they said, "It is okay if lives are endangered or misery is allowed to fester. It is not okay to lose votes over it." In 2017, Labor promised to improve the performance of the health system. Yet under 3 successive Ministers for Health, the Honourable Roger Cook MLA, Honourable Amber Jade Sanderson MLA and the current Minister, the Honourable Meredith Hamat MLA, ambulance records have escalated. Ambulance ramping records have escalated. The government blames an ageing population, a bad flu season and the aftermath of COVID. But the truth, as the health professionals keep telling us, is that the causes are structural: not enough beds, insufficient surge capacity and under-resourced emergency departments. Dr. Peter Aleli from the Australasian College for Emergency Medicine told ABC Radio Perth the problems were structural and much deeper than a bad flu season. He said, "So we've built a system that just has no surge capacity and can't cope with the natural fluctuations in disease patterns that are always there." And what makes this worse is the Premier's dismissive attitude towards it. Today we are rebuking the Premier for his arrogance. When the Leader of the Opposition, Basil Zemplis MLA, wrote to him a short letter of concern, the Premier refused to even read it. That is not leadership. That is arrogance and a sign that the Premier is not listening to the community. When lives are on the line, Western Australians expect compassion, accountability and action, not contempt. The Premier continues to call our health system world-class, yet it's clear that our hospitals are in crisis. On the 7th of September, the West Australian revealed that despite the health crisis, the government has initiated a financial sustainability task force. Comments from senior staff have been warned of more punitive actions if they don't come up with savings. Now, a senior health executive who asked to remain anonymous said to the West Australian that it was the wrong time for the department to be looking for cost savings. And I quote, "There is nothing wrong with looking for efficiency. In fact, we should always be looking to utilise taxpayer expenditure in the most appropriate way that we can. Should we be having that conversation when, anecdotally speaking, people are dying while waiting to get into emergency departments and queues of ambulances are parked at the door? I'm not sure that we do." This is exactly what we mean when we say that the Cook Labor government has the wrong priorities. And yet, when in the Legislative Assembly only days later, the Minister for Health continues to deny and deflect, insisting that this task force is not a cost-cutting exercise, and again saying further there are no targets for cost-cutting measures. Yesterday, I also asked what the savings targets of Labor's new Health Financial Sustainability Task Force were and which jobs would be cut. The Minister's response, again, was that the task force has not established any cost-saving or FTE reduction targets and that it is focused on system-wide reform, not reduction. Frankly, these non-answers would almost be funny if it wasn't so serious. The West Australian revealed leaked briefings showing blanket bans on new full-time staff, cuts to so-called non-patient-facing roles, and threats of punitive action. So which is it? A task force with no mandate to cut costs, or a cost-cutting blitz disguised as reform? When a government says one thing in Parliament but does another behind closed doors, it undermines public confidence in the system. It is reported that hospitals are still recording multiple code yellow emergencies every day due to overcrowding. Our emergency departments are overcrowded, maternity wards are under strain, and our regional hospitals in particular are struggling to cope. There are gaping holes everywhere in capacity, in staffing and in resourcing. And today we are calling for reasonable and necessary action to address the concerns of Western Australians. How can we move forward? We call on the Premier to apologise to the people of Western Australia for ambulance ramping having worsened so dramatically during his tenure as either Minister for Health, Deputy Premier or Premier. We call for the Premier to review the ministerial model that he imposed following the 2025 state election, which now sees the health portfolio split between a multitude of ministers, creating confusion and delay, with ministers avoiding answering questions and passing them to each other, particularly in estimates. This is a political reshuffle of responsibility from minister to reduce accountability. We call for the government to axe the track. Locals don't want it, and this is a prime example of wrong priorities. The government could immediately reinvest $217.5 million from the racetrack at Burswood into our health system to address the hospital crisis. $217.5 million. That could fund more than 68,000 hospital bed days or hire around 2,500 extra nurses to relieve the pressure in our health system. And we call for the Premier to take personal responsibility, to ensure that his health minister makes ramping her top priority, to address it as it is a symptom of the issues in our system, that she should prepare a plan, execute it and report back monthly until this crisis is under control. This shouldn't be needed to be asked. It should be already being done, but it isn't. And it shouldn't be too much to ask for some reporting back to Parliament in this way. More than 7,000 hours of ramping per month cannot be the new normal. Lives are at risk. The Premier cannot continue to shift blame. He must take responsibility and he must act. This motion sets out a clear pathway forward. Every hour an ambulance is ramped is an hour someone is waiting for help, and that must end. Yet it's risen year on year. The problem is structural, and this government has had more than 8 years to fix the problem, but it just gets worse and spirals out of control. Cutting elective surgeries to free up space is not a solution. It simply shifts the problem elsewhere. And patients waiting in pain for surgery deserve better. I'd particularly like to focus on some of the issues that show that this has not been addressed at a proper level. And a lot of these comments come from Dr. Peter Aleli, who has spoken openly on this. He is a WA Emergency Department doctor, and he's described the situation as the worst he's seen in his 18-year ED career. He said that the way the problem is being attempted to be dealt with is that they are getting phone calls on a daily basis to get people off the ramp who aren't fit to be got off the ramp and are being put in the waiting room unsupervised because there's not the resources to look after them. In addition, he talks about that problem of patients not being looked after in our emergency waiting rooms. He says, and then bad outcomes are happening, like the patient who suffers from dementia, who comes in on an ambulance and gets put in a waiting room. even though they're not safe to be put there, and then has a fall and injures themselves. Those things are happening almost daily, I would say, in most emergency departments around the state, and those incidences will increase. The risk in our waiting rooms, in particular in the emergency departments, is just rising and rising and rising. The structural issues need to be addressed. There are calls for greater investment in better ways, for upgrades, for new hospitals, for significant investment and reform. The medical profession is calling for urgent impact to address these issues and to try to improve the system. They've highlighted issues with diverting pressure from one part of the system to another and say that this is not reform. It is a triage management of a broken system. And this is why the motion before us today is so important. It calls for accountability. It calls for the Premier to take responsibility, and it calls for real action, because Western Australians should not be forced to accept 7,000 hours of ambulance ramping as the new normal. Every time this government shrugs its shoulders and says this system is world-class, adds insult to injury. And I urge members to support this motion, because the people of Western Australia cannot afford for us to do anything less. Thank you.
Members, the question is the motion be agreed. The Parliamentary Secretary for Health.
Thank you, President. President, I rise to respond to this motion on behalf of the government. President, this motion today is not about fixing the ambulance service. It is about scoring cheap political points, rewriting history and distracting from their own pathetic record when they were in government. President, our ambulance service is under serious pressure, and there is no denial of that. But the opposition pretending that they are the